What should adults know about smoking around pregnant women and babies? Smoking around pregnant women can be detrimental to both the mother and her unborn child. If around for a prolonged period, it can cause or worsen cancer, asthma, respiratory infections, and coronary artery disease. Being pregnant and around smoke doubles your risk of abnormal bleeding during pregnancy and delivery, along with having the possibility of a miscarriage. Smoking raises your baby's risk for birth defects, which include cleft palate, cleft lip, or both. The unborn child can be born prematurely and have a low birth weight. Having a baby exposed to secondhand smoke can cause life-threatening side effects. Smoking around a young infant with underdeveloped lungs are at a higher risk for sudden infant death syndrome. They are likely to have more ear infections, coughs and colds, respiratory problems such as pneumonia and bronchitis, and possible tooth decay. Babies can have instant symptoms such as coughing, sore throat, and eye irritation from the smoke and chemicals. We can help reduce the dangerous side effects for pregnant women and babies by trying to create a smoke-free environment and spread awareness of all of the dangers.
Smoking around the infant. When a person smokes, they leave behind a second and third-hand smoke, which can be found anywhere the smoker has been. Ultimately, this can affect every aspect of the infant's health in a very negative way, so it's important that we become aware how much it will impact the infant. To begin with, secondhand smoke is smoke that has been exhaled by a person smoking. Secondhand smoke can be found anywhere the smoker is. It can also produce third-hand smoke. Third-hand smoke is smoke left behind in places people have smoked. Where can both of these be found? Third-hand and second-hand smoke can be found wherever the smoker has been. It could be in homes, cars, in your clothes, bus, restaurants, and various other places. This can affect the infant's health because it can cause ear infections, severe and frequent asthma attacks, coughing, sneezing, shortness of breath, respiratory infections like bronchitis and pneumonia, and a greater risk for infant death syndrome.
The impacts of nicotine and smoking or vaping on the fetus and newborn. As a fetus is developing through pregnancy, it is completely dependent on its mother's care to develop into a healthy newborn. Some impacts on the fetus can be birth defects such as cleft lip or cleft palate, placenta previa, which is when the placenta forms at the cervix and it increases the mother's chance of bleeding during pregnancy, or she could need a cesarean birth. It can also increase the risk of death for the mother and child. Maternal nicotine use can stunt the growth of the fetus, causing brain damage to the brain and damage to the developing lungs. Nicotine can also tighten a mother's blood vessels, causing less oxygen and food to get to the fetus. Some impacts of maternal nicotine use on the newborn may be a miscarriage or a stillbirth or a premature birth. It can also cause a low birth weight baby, less than 5.5 pounds. Maternal smoking doubles the chance of a low birth weight baby and a premature birth. And small babies are often sick with many health problems. Another impact of maternal nicotine use is sudden infant death syndrome, also known as SIDS. And a newborn can also develop colic, which is frequent, prolonged, and intense crying or fussiness in a healthy infant. And a newborn can also develop asthma and high blood pressure. And lastly, childhood obesity can also cause diabetes.
Addressing the harm done by fathers and mothers who smoke during pregnancy. The harm done by fathers during pregnancy is knowing that fathers are a large source of secondhand smoke and do more harm than women smoking themselves. The risk for heart defects increases by 75% if the father smokes. Smoke exposure from the father to the mother increases the risk of low birth weight, SIDS, and brain damage to the fetus. The harm done by the mothers. Women who smoke have a higher risk of never becoming pregnant. Exposure during the embryonic stage, which is where 95% of all body structures will be developed, can result in abnormalities and defects in those body structures. Long-term effect on offspring can also be affected, including diabetes and high blood pressure. Sudden infant death syndrome is 3 times more likely to occur if the mother does smoke.